You know, in their lifetime, 1 in 8 men will be diagnosed with prostate cancer. And while many patients worry about how treatment is going to affect their bladder, their bowel, or their sexual functions, Trinity Health Michigan focuses on combining effective cancer treatment with preserving quality of life. And today we're joined by Dr. Sheldon Holder. He's an oncologist at Trinity Health Michigan to talk about prostate cancer. It is one of the most common cancers in men. Good morning, doctor.
Good morning.
Let's talk about the prostate cancer itself. Can you explain where it is, what's happening inside the body?
Sure. The prostate is a male reproductive organ. It sits right below the bladder and the pelvis. So men are at risk of developing prostate cancer. And
what's happening? Just developing cancerous cells?
So the cancer cells will actually start in the prostate itself.
Okay. If you've got that diagnosis, you've got cancer cells on the prostate, and we're going to treat it, what is Trinity Health doing to preserve quality of life? There are many different ways to treat this. Correct.
There are many ways to treat prostate cancer, and Trinity Health has actually partnered with University of Michigan Health West in a network, the Cancer Network of West Michigan, to improve access to screening, which I'll talk about in a minute, and then treatment options for men with prostate cancer and for multiple other kinds of cancers.
You know, I'll let you talk about that screening now, because a lot of times that's the part that keeps people from getting the test, is the fear of the screening.
Yes. So screening is actually very easy. It's a simple blood test that can be done by your primary care physician.
Okay. A blood test. Okay, just keep that in mind when you go in for this test. And who should be screened? When should we start?
So the average male with the average risk of prostate cancer, we recommend starting at the age 45. Some men have a higher risk, that is if you have a family history, so a father or a brother with prostate cancer, then we recommend starting at 40. And also black men, so if you identify as black, black men are more likely to develop prostate cancer, and so we recommend starting earlier also at the age of 40.
Okay, really quickly, let's rapid fire the treatment options available. What do we got?
So surgery is an option.
Okay.
Radiation therapy. Okay. We also have medication, so hormone therapy. And then new fancy therapies, we call these targeted therapies. Okay. All of these are designed to treat the cancer with as little side effect treatments on normal cells.
And it's those targeted therapies that we're really talking about here that help preserve your quality of life, the bowel function, the bladder function, things that we were talking about that could be affected by this.
Correct.
A place to get more information. We've got to have a website somewhere we can go. There it is, trinityhealthmichigan.org. Let me say it again better, trinityhealthmichigan.org/prostate cancer. Screenings, treatment options, even that support that you may need, all waiting for you on that website. Thank you so much for the time this morning, doctor.
You're welcome. Thank you.